we're going into these drugs, we're going to start getting into a few more of the exotic ones. And this is definitely one that you don't see too often that we give, but we see it a lot when we transfer patients, so you got to be aware of it. And there's some real big dangers to this guy, which is, of course, potassium chloride. So again, just as a little sidebar, this is what they actually use to stop people's hearts that are on death row when they give them lethal injection. So obviously, if we're giving it as a medicine, we kind of need to know what it is, how it does, how it works. We'll move my little head up here, guys. Okay, so that's not even better, so we'll try it down here. All right, so the potassium chloride, it's also known as Chlorcon, Slow K, K-tabs, and is used for the treatment of suspected hypokalemia. So when somebody's potassium is low, this is the guy that we use on that. It maintains electrolyte balance, you regulate nerve conduction and muscle contraction, and it participates in, again, carbohydrate utilization and helps us synthesize certain proteins, but it also helps to maintain the acid-base balance. It's one of the buffer systems that's in it. The big one, though, is up top here. It maintains the electrolyte balance. Boy, it definitely does that. So again, this stuff onsets, it usually takes about 15 minutes to onset. Even when we give an IV, it's a little bit faster, but it takes a little bit of time for it to work. And then the duration of action is usually about 1 to 2 hours given in the IV form. When it's given in the tablet form, guys, it actually kind of extends out a little bit longer. And as a matter of fact, most of the medicines will say slow release, so that it releases slowly into the bloodstream. So we use it to treat potassium deficiencies. And as we're starting to go into our cardiology a little bit more, one of the big drugs that we love to use for our congestive heart failure patients is Bumex and Lasix. And both of these guys deplete potassium. So most of the time, if you see a patient who is on some sort of water pill, Bumex, Lasix, you're going to see them being treated for a low potassium level. And almost always, if you see one of those two meds, they're on Lasix, they're probably on Chlorcon, or they're on K-Dur. They're a guarantee. Start looking around, you're probably going to find that in the med list. So if you get too high of potassium, that's where the danger kind of falls. And you get confused. Again, big one here is arrhythmias and cardiac arrest. Okay, it can respiratory depress people. It can cause abdominal pain, diarrhea, nausea, vomiting. It can cause hyperkalemia. We all know that hyperkalemia, not a good thing. Okay, that's too many kids in the schoolhouse, gang. And if you got too many kids in the schoolhouse, it's overcrowded. It doesn't work the way that it's supposed to. When we don't give it, if we know that they have a high potassium, we don't give any more potassium. It kind of makes sense. Remember that if they're not working, the kidneys aren't working, that's where potassium is excreted from. So if the kidneys aren't working, please don't be giving these patients potassium unless you really need to question why that's being given, okay? The problem is when we give too much, it's not going to get out of the system. It can cause some major problems. We've got to make sure that this IV is patent. Absolutely 1,000%. You cannot, if it goes into the interstitial tissues, it's going to cause tissue death. So make sure that you do that. And if they're complaining of burning at the IV site, the IV should be checked for the patency. The other thing that we do when they're burning it at that site is we slow it down. One of the other things I've done is kind of put it like a cool pack, not a ice pack, but a cold pack over the area. Sometimes that helps after I'm 1,000% sure that it's actually going into the vein, okay? So we double check that. We make sure that it's doing that. We usually put a 40 milliequivalents. It's usually in a 20 milliliter vial. Actually, in the hospitals, they usually have the pre-made bags, and it's usually the 20 either 20 or 40 milliequivalents that are added to the bag. This is given via my IV infusion. We don't actually push the potassium. There's really rare cases where they maybe push a little bit of it, but most of the time this is given in a drip form, okay? 10 to 40 milliequivalents is added to the IV bag and administered at a rate of no more than 10 milliequivalents per hour. In pediatric, you definitely, this is the one where you call the pediatrician aside and say, hey, I need to know exacts here because we don't want to do it. All right. This is a huge major rule that I find broken a lot of times. You'll get to a floor, they don't have the patient on they'll have the patient on the potassium drip, but they don't have them on any type of cardiac monitoring. No, they have to be on a cardiac monitor. I'm going to say that again where you guys understand it. I'm going to move my little head over here. No, you need to have them on a cardiac monitor. Put them on a cardiac monitor. I assure you, if you do not, I'm telling you, you're headed for trouble. One of the biggest ways we make sure that they're not overdosing these fine folks is we're looking for a QRS widening. We're looking for QRS duration, longer QT interval. Guys, you got to have them on a cardiac monitor. If they start slowing down, that's a problem. Too much hyperkalemia, again, major problem. All right. So we give this via IV infusion, and pregnancy, actually, it's not too bad. I very rarely see this, but every now and then you'll run across a patient that's on a potassium drip for there. All right, so this is kind of a small one. Again, the big one here. Keep it slow. If they're complaining of burning, slow the IV down a little bit, and have them on the cardiac monitor. I can't stress that enough. Please have them on a cardiac monitor. Okay, that's it for potassium, guys. I'll see you on the next one.